Hi, and thanks for sticking around, those of you here and on camera. Um, this has been a real learning experience for me. I came to the last IOM Biofuels workshop, and there we really focused on air pollution and tailpipe emissions and things along those lines, but this time we focused on the whole picture, which I found very interesting. And when I think about it, let me tell you a little bit about what I'm taking back from this. The good parts, okay? Changes in the spectrum of pollutants is likely to be less damaging, although that's not clear yet. But let's say that is likely to happen if you use biofuels to replace some of the things we're already using. It does bring economic support to rural communities, and that has health implications. There's little doubt that that has health implications, both good and bad. And it potentially contributes to national security, although I have my doubts after some of our discussions yesterday. There are clearly bad things associated with the use of biofuels from the point of view of health. Water insecurity is not just an ecological problem. Water insecurity is a health problem. It is a problem across the entire spectrum. Food security is a problem anywhere. Food insecurity is a problem anywhere. And that looks to be something that would have big implications on health. And finally, depletion of agricultural resources, again, is likely to have major implications on human health. I found some things confusing that I still don't quite follow. Is it or is it not efficient to create biofuels, ethanol from corn? I mean, that's a fundamental question for us. If it's 1 unit of energy to produce 1.01 units of energy, then why are we doing this? And yet that fundamental question has not really been brought to the forefront and a complete answer given. That's not just a question of economics. That is a question of health. Because if we're not making substantial gains from creating the biofuel, then the energy that's spent to make the biofuel itself is a pollution source that will be contributing to health concerns. The subsidies stuff totally confuses me as to what its implications are, but I'm willing to bet there's implications for health from those subsidies, and I'm going to take some time to think about that and look at those issues. And then I think I'm going to agree very, very much with the last panel that we need to look at this from a point of view of a health impact assessment. Now, NCH-ATSDR is a classic CDC center, or two centers. We're tasked with protecting people and saving lives by preventing harmful exposures that they have in their environments. We have a number of programs that touch on the biofuels issue, but it's not major within our programs. We do have a climate and health program, and certainly they're aware of what's going on in biofuels, but they don't have a big focus there. Our asthma control program has looked into the issue of biofuels. Do the exhaust coming out of the biofuels trigger asthma as readily as do diesel exhaust or gasoline exhaust? And they're still looking at that issue. I do have a environmental public health laboratory, and one of the big things they do is biomonitoring the U.S. population and looking within that population for chemicals in blood, urine, or other bodily fluids, and trying to measure it on a national basis to see trends in those compounds. And some of the things we do are relevant to biofuels. There are aldehydes in there that we follow that are relevant to biofuels, and a dozen other things. So it's not clear that we have a mechanism to track if the exposures to biofuels are getting higher in the United States, but it's something we'll look into and think about. Now, I'm a systems person, and when I think of environmental exposures, I think in terms of systems interacting with systems for interacting with systems. So for example, human beings don't just exist by themselves. They exist within an interaction network of our environment, and our environment is both global and solar. So don't think that the sun and everything associated with the sun does not, in fact, impact our health and the health of everybody on this planet, it probably gives us most of what we have on this planet. Next slide. We also have networks within our bodies. So these networks interact within our bodies interact with the outside world, and the consequences for health of all of these things are extraordinarily complicated when you tweak that complex outside environment in which we live. When you think about energy policy in the United States and what its implications are for health, it gets very complicated. Let me show you the simple slide of energy and health for this is global. If you could show me the next slide. Now this is our simple slide for looking at it. And basically, we break it up here into some broad areas, but when I start thinking about biofuels and what the net impact might be, this picture is pretty good for playing that question. So as we look at biofuels, we know there are going to be changes in air pollution from using biofuels. We're not absolutely certain what they are, but changes in air pollution can be detrimental or beneficial to health depending on which way they go. And I think that's an area we have to carefully look at. We talked about climate change considerably here, and again, climate change is it's not just environmental, it has different types of implications on human health. Changing the ecological system, we talked about the use of what used to be grasslands and now for corn, because it's much more economic to even go all the way down to the river itself and use that area. These are having major impacts on our ecosystems, and the ecosystem services we get from those have real implications for health. And so we have to be able to understand that as well. Water insecurity, the quality of the water that we use and drink, the quantity of the water we have available to us, very important to health. And then the one thing that's not often mentioned or discussed are the social systems themselves and the economic systems. You know, you go into a small community and you put a large factory into it and you bring in a lot of outside workers, and a number of things happen to health. STD levels go up, cost of housing goes up, mental health issues go up in those communities, that we've seen it over and over again. And those types of boom and bust situations have major impacts on human health. So when we think of doing a health impact assessment, say for comparing use of biofuels as they exist now versus not using biofuels as they exist now, these are the types of things, all of which would have to be looked at in order to be able to do that health impact assessment. Thanks.